Welcome to the Byja Radio Show. I'm your host, Dr. Byron Jasper, and we are recording live from J. Kinba Executive Suites in Baton Rouge, Louisiana, with special production by Becnel Media. All right, we are back, and episode 16. I am Dr. Jasper, and we are recording with Byja Radio. And I have to, of course, always roll out the red carpet for the stupendous, the magnificent, the superb patient zero, Mr. George Becnel.
Hey, man, you're too kind. You can keep going, though, but you're too kind.
Might as well, right? Just go ahead and roll out the resume at this point. So we are at episode, we are at episode 16, and I think it's pretty significant to say that we are doing some great work here, to the point where I've had different people ask different questions and actually stop me and make comments, as we already know happens from different things that George has said. But more importantly, when people are asking questions based on things we've said in the episode that are educational, I'm taking it as a sign of we should keep going.
Yeah, man. I think so. And what was really encouraging, for the radio show and for actually the clinic, I had a friend of mine said, he listened to the podcast and to the radio show, and that's why he joined the clinic.
Yeah.
Because of the way we discussed what was going on, and that made me feel really good, because number one, someone's actually listening.
Yeah.
And number two, we were actually talking about some impactful things. I know we like to have fun,
right?
But at the end of the day, we're trying to be impactful. We're trying to educate, and we're trying to be there and be present in our community. So that's important.
Well, I think today's topic is going to definitely do similar things. It may not be in the most traditional healthcare way, but it is going to be impactful. And I would say, George, if I may ask you a question, what is probably one of the most impactful things that happens in everyday life that people oftentimes are looking to get and also struggling when they don't have it? Anything concept-wise you would think might be impactful from a medical standpoint that's not quite medical, but people need a lot of it or want a lot of it, and then when they don't have it, they're oftentimes struggling or complaining?
I mean, that's a loaded question. I'm gonna go with like oxygen,
of course.
Water,
that's health.
Food.
Let's go non-health. Let's go with non-health. Related to health, but non-health. All right. I'll give you one simple hint. It's green.
Oh, money.
Money, exactly.
Oh, yeah.
Exactly. Super impactful in healthcare.
You definitely need money.
Definitely need a lot of it or want a lot of it. If you don't have it, it's a struggle, right? Yeah, so we're talking about money today, and we're talking about money in a very specific way that should be helpful and impactful for a lot of people, because a lot of people who listen to us are small business owners.
Thanks.
And if not small business owners, they work in a small business. So those people are going to probably be the target audience for today. So today we're talking about big things related to small businesses and how hopefully DPC can help small businesses and small business owners save money. That's pretty much what it comes down to. So the biggest question is there a way to significantly reduce a business's healthcare cost and improve employee satisfaction and productivity? Is there a way to do that? I think simply, of course, people would say there are plenty of ways.
Right.
But is there a way that's easy, tangible, and feasible? Well, you can definitely throw out a bunch of different things you can try to do that will improve productivity, help with employee satisfaction, but at the same time, improve costs. That's the tricky part, right? Usually when you're trying to improve productivity and then make employees more satisfied, you got to spend money. So to do all three, where you're improving satisfaction, making them more productive, but also spending less money, that's the trick. And that's why that question is often posed. How can you do all three? Any idea how can we do that besides just saying, hey, well, direct primary care is an option? Is there any other way you would say that we can do that from a healthcare standpoint?
From a healthcare standpoint, I would say, direct primary care is obviously an option.
Yeah.
But just to provide some type of group benefit, right?
Yep.
And, a lot of people take things for granted because, most of my adult life I've worked for big conglomerates, right? Where you have health insurance thrown in there and you don't have medical costs that cost an arm and a leg until you go to urgent care and have COVID. But, I digress.
Right.
But for the most part, right, it's pretty affordable. But, a lot of people don't have those type of benefits. Like you said, people work for smaller companies, people work for nonprofits, and a lot of people take jobs that don't offer any type of insurance benefit at all.
Yeah. So I think you hit the nail on the head. There are options to do this, but you more than likely have to go to a really big company that almost in essence takes a lot of the cost off the table because they're more than likely spending a lot of the dollars to offer these big insurance packages,
Facts.
right?
Right.
Now, even if you ask them, is there a way to do all of this and save money? I'm sure they would say no. The thing is that people who are in the small business world, and if not work in the small business world, not necessarily be an employer in the small business world, they don't really have an answer that can be, I can do all three. More than likely, you're going to spend money to do one, if not both, the employee satisfaction and the productivity piece. So if there isn't a really good way other than go and work for a big company, well, how do we actually get to that point of doing all three? Well, we'll get to that. But let's start by just setting the stage. If you say, well, why is trying to save money a big deal when it comes to being a small business, especially in healthcare, especially as you just said, people oftentimes just can't offer healthcare in a small business and you're taking a job where you don't have benefits, you're kind of rolling the dice. Well, let's explain why people who have small businesses oftentimes can't offer these types of things. Okay.
Well, it's expensive.
Well, okay. Well, I completely agree with you. Expensive makes sense, but let's talk numbers because expensive is a relative term, right?
Okay.
Your expensive may be different than mine. So let's start talking insurance. I think it's real simple. So with insurance, any idea how much we're looking at from a premium standpoint when you're saying if you're an employer and you are trying to offer insurance to a single person or a family member, how much do you think that coverage may cost when we're talking about premiums? And let's talk about for a year, right? Not necessarily each month, because I'm sure that's an easier number, but let's talk about big picture. So if we're saying I'm offering insurance to an actual person versus a family, how much do you think it may cost from a person versus a family for a year? And this is just premiums. We're not talking about deductibles. We're not talking about co-pays. We're talking about just the premium that you would pay month to month. How much would it add up after we get to month 12?
Without a group benefit.
Without a group benefit, you're a small business owner.
I would say at least, I don't know, $12,000 a year, something like that.
So are we talking about individual or family?
Individual would be $12,000, I would assume.
Okay.
Family would be somewhere around $24,000.
Okay.
I'd assume.
So ideally, depending on where we're at, these numbers are basically averages, right? So the average cost for an individual, and again, I'm sure we can find people who are listening and go say, well, I wish mine was this. But for an individual, insurance premium for a year usually is around $9,000. $9,000, right? You said 12, so not too far off. And you are spot on for the family. So a family coverage is usually about $24,000. Now, what size is the family? All that, we're not going to get into that. But if you're saying for a business owner to offer family coverage, meaning there's a husband, a wife, and children for the most part, if you're having that family set up, you're spending $24,000 as a business owner to possibly offer this insurance to someone. Okay. Now, the $24,000 can be split in multiple ways. $24,000 could be they pay 12, you pay 12. They pay 20, you pay 4. But the idea is if it's a $24,000 premium, somebody has to cover that 24 in some way. Now, with small businesses, as you already know, the goal is to try to save money and keep your overhead low. So them eating a $24,000 bill just to cover a person and their family is going to be really tough. So that's automatically a non-starter. And that's a family. So you say, well, what if it's just an individual? Well, if it's $8,000 to $9,000 and you're covering that one single person, before you're adding deductibles, co-pays, and all that, you're having to split the $8,000 one way or another. That can be problematic for a lot of people.
Right.
And that's just talking about the premium. Now, why is that number important? Would you think, and I'm sure you know the answer to this, but I'm going to pose it anyway. Would you think that that premium is going to go up, down, or stay the same year after year? It's not a hard question. I want you to take your time and really think about this.
It's like everything else in life
Right.
is going up.
It's going up. The question now is, if it's going to go up, how much do you think it goes up year after year when we're talking about insurance premiums? And give me a number that you feel like, okay, well, this sounds like a good range.
Well, inflation is 8%.
Okay.
So I would have to assume that it has to move with or a little higher than inflation. So I would say 8 to 10% every year.
So I think you're spot on. It's usually around 7% that these premiums tend to increase as a average. Now, it could be 20, it could be 10, it could be some range that will allow you to end up at 7, but 7% year after year is usually where premiums increase, as you just said. So inflation is kind of a spot on thing. Now, this is my favorite part. You just said, okay, we got a $24,000 potential cost or an $8,000 cost, maybe 9, 7% increase year after year. And again, we're not going to get into the math, but this is the thing. The insurance has to be covered by someone. As a small business owner, I'm going to ask, what do you think a small business owner would feel comfortable covering for an employee to where they say, I'm okay paying this, and I'm going to literally be able to pay for the insurance, pay all these other bills, and still turn a profit? What is the percentage you would think they might have to do?
I mean, I would assume that it's a fraction of that. Like, it's for an individual.
You're right.
Like $9,000 a year. I wouldn't. As a business owner, I would say maybe $2,000 a year, maybe.
Right. So you're literally, again, doing a very, very small percentage, right?
Right.
Now, let's flip it on its head. How much do you think the big corporations tend to pay of the insurance premiums?
They pay about 90% of it.
Right. So 80 to 90%. So it really warps people's brains to think, well, my insurance is really good insurance because they cover everything. Well, again, the business owners, whoever that big business is covering 80 to 90% of your cost. So they literally feel very, very good about saying, we offer you good insurance, so you should be happy and you should stay and I never want to leave. On the other hand, the small business, who's probably a much better fit for you because you feel better, you know the owner, you know the company, you're starting on the ground floor, but they can't afford it. They can't afford to give you 90% of, and let's make simple numbers, $10,000. They can't give you 90% of $10,000,
right?
And they're just getting off the ground. So it really puts the small business at a disadvantage when it comes to recruiting and holding on to good talent. And then the other company that's covering 83, 90 something percent of your premium, they are very much more empowered to keep you exactly where you are because you feel like, look, I don't want to leave because I don't want to lose this insurance.
Yeah, I got good insurance.
I got good insurance. And overall, these numbers are starting to literally cloud people's judgments because they don't really look at it from a business standpoint. They look at it as, I got coverage, so I should be happy. And then the people who are administering the plan, the owners, think, you got coverage, you should be happy, right? It's not about, is the coverage good? It's not about, are you getting all the best healthcare results? It's about dollars and cents when it comes down to pulling back the curtain.
Right.
And we haven't even gotten into wait times and things that are covered and things that are not. But if you do the math in your head, you're saying, I'm trying to spend less to keep my doors open. I'm trying to recruit top talent. I'm trying to find a way to keep them on the job. And I'm also trying to find a way to make sure they don't go somewhere else. And as a small business, I have to do all of this and still run the business. How is that possible? Is there any way, shape, or form that makes sense? Again, I got to recruit top talent. I got to keep them. I got to keep them healthy. I have to also find a way to cover the bill for them to have insurance. I still got to run my business, and I'm somehow supposed to do it all, wash, rinse, and repeat. Is that even possible, especially when you're competing against someone who's going to pay 90% of a premium?
No, it's not. And you would almost have to pay. You'd almost have to spend that money anyway, whether you go pay for the insurance or you go pay extra money in the salary to stay competitive.
Yeah.
Right?
So you're in this setup of, I'm fighting upstream or uphill or whatever terminology you want to use, and you're trying to manage an insurance premium. You're trying to manage the claims that come with the actual insurance. You're trying to manage the employees, and you're trying to keep people somehow happy, productive, engaged, and satisfied as a small business owner. And you're literally just struggling to do this.
Right.
So the point I think we're trying to come up with is it's damn near impossible to do unless you're somehow finding a magic solution that can do all of the above. So as we're talking about this and making this make sense, how can you have this conversation when you're doing these things with someone and come up to the small business owner and say, I really want to make sure that you have the best health care for your employees. I want to keep you from breaking the bank. I'm not going to sell you something that's going to literally leave you having to close your doors. And then, oh, by the way, the employees may leave anyway, because even though you're buying this, it still may be very expensive on the back end. And it's so expensive you can't keep paying for it. Eventually, they're going to leave anyway. I don't think there's a really good solution where someone walks in and says, I can do all of this and really keep you in business. They're going to sell you something. And the thing they're selling you is going to sell you the idea, but not really deliver. Mm-hmm. And that happens with a lot of the people who come in with the insurance plans, and they want to sell you an insurance plan, but then they disappear. Mm-hmm. Now, that's not everybody. We have some people out there that are really good advisors or brokers that will possibly come in and work with you as a small business owner and help set you up. So whenever you do start to offer insurance, you don't go out of business because you're paying so much in insurance premiums, co-pays, deductibles, everything else. However, most of them don't do that. Most of them sell you a policy. The person selling you the policy, how do you think they get paid? Because you're not giving them money out of your pocket. If
they
you're
get paid on commission.
They get paid on commission. And what do you think the commission comes off of?
Off of what you're paying.
Off of the premium. So they're incentivized to sell you a bigger policy than to sell you the policy that's more affordable. And they're more incentivized to sell you that policy and keep you on it year after year than to come in and say, well, you're spending way too much in premiums and no one's using it. You're spending all this on premiums and no one's going to the doctor. So let's back it off. Let's decrease your, they're not going to do that. They're going to sell you whatever and then kind of leave you to figure it out. So at this point, you're now having to be your own administrator. You have to also be your own accountant. You have to be your own insurance person. Then you have to somehow keep the employees happy. Make sure they're using insurance, but don't use it too much, because then it can basically confuse and break your bank and everybody else in between. So it's really a very bad system. Yep. And we know it's a bad system. And if the employer-sponsored healthcare system is bad, on the employer side, what do you think the patients or the employees are seeing on that side from a small business? Do you think they have confidence in the employee-sponsored health plan from the small business owner who never looks at this?
There's no way, because working for a major conglomerate and seeing all the insurance changes from year to year to year and all the options change, it's confusing and annoying for to work for a company that's paying this 90%.
Right.
Because at one point, like I remember, I might be aging myself, man. I remember I used to go to the doctor for everything, because if I wasn't feeling right, if I wouldn't, if I had like a tingle that I wasn't supposed to have, whatever, I go to the doctor. I had a $30 copay. I wasn't hurting for that. Look, I give the doctor $30. I feel better. I feel good. It's straight.
Yeah.
Then all of a sudden, it turn around, and then I learned this new word called deductible.
Didn't know it was a thing at first.
I didn't know it was a thing at first. Now all of a sudden, you can't get no copay until you hit at least, I don't know, $1,500.
Yeah.
Or $3,000 or $6,000.
Yep.
And I'm like, there's no way I go to, like, I'm relatively healthy, right? I'm not gonna act like I'm the most, like I'm not LeBron fit, right? But I'm relatively healthy. There's no way I'm going to spend $6,000 worth. So in essence, I'm really letting them take $100 and something a month out of my check in case I go to the hospital.
Yeah.
Because that's the only thing that is helping with, because I'm not hitting the deductible.
Yeah.
You know what I mean?
And it makes very good sense from your standpoint, because you're actually able to kind of look into it and explain deductible and premium and co-pays. Whereas we have some people who come to us and they'll bring us their insurance plan and ask us to explain which policy they should choose, which level they should opt into based on their healthcare needs. And again, being the doctors, we know, a little bit more about what to pick and what not. But that goes to show that the employers are often confused. The employees are often dissatisfied.
Yeah.
And the people who are often sitting there twiddling their thumbs saying, this is great, let's do more of this, is the insurance company itself. So in those instances, you're sitting back saying, well, what can we do that may change this narrative? So we, of course, do this show all the time. So what do you think we're going to say that can help you start to weave through all of this foolishness?
You know what? I didn't study for this, but I'm going to say direct primary care.
I think it's a good answer, man. I think it's a really good answer. So let's see if we can start to kind of peel back the layers that we just went and built from an insurance-based standpoint for an employer that DPC helps to address. So we already know what direct primary care is, but for the people who might be new listeners, direct primary care is membership-based medicine, where regardless if you have insurance or you do not, you pay a monthly membership fee once a month. And with that monthly membership fee being paid once a month, it gives you access to different services. It's very simple, very straightforward, and very transparent. You pay once a month and you get access to medical care. That's it. It's not complex beyond that. Whether you got insurance or you don't, you pay once a month and you have access to care. So in that instance, we tell people in our clinic, we're like Netflix for medicine, or we're like a gym membership for medicine. With the gym membership, you pay the gym once a month and you can go work out as much as you want, when you want. With Netflix, you pay once a month, you can stream usually as much as you want, and that's it. So with us, you pay once a month, you get care for the 30-day window as much as necessary. And in that sentence, and in that instance, that is DPC. Now, why is DPC helpful for a small business? Well, let's start very basic. DPC is a flat fee each month. So when it comes to insurance, even though you have a premium that seems pretty set, George, you just mentioned they also have copays, they also have deductibles, and then they also have costs that are attacked on the labs and meds and things of that nature, correct? So that number can be up or down, especially if you go to use the insurance, because those numbers may be set, but if you go use it, the copay could be this. The doctor can drop a bill, and the bill could be an expensive bill or a non-expensive bill, depending on what they charge and what they code. And once that coding is done and submitted, the insurance then tells you how much it costs. And then at that point, your premium, even though it's set, your deductible, even though it's set, your copay, even though it's set, the number that you're paying starts to shift to where you have no idea what it is until you get a bill on the back end or an EOB, an explanation of benefits.
So let's unpack that a little bit for some people who not really familiar with the process.
Okay.
Because something that you said was very, very important, because it's not always just numbers. Sometimes it's about where the bill comes.
Okay.
Because what to your point, sometimes you go get service and they haven't run it through your insurance yet. They're going to bill your insurance.
Yeah.
So they have to send it off to your insurance. Your insurance has to verify whether you have coverage, obviously, and where you're at based on your deductible. And guess what? And if you didn't meet your deductible, they come back and they say, well, we paid for this, or we only paid X amount for this. Now here's your portion, which you have to pay. And it got to a point where you were at the doctor 2 months ago, and all of a sudden you feeling good, you minding your business. Now you get this big bill 2-3 months later down the road that you weren't expecting to pay.
Right. Exactly. And that pricing transparency or lack thereof
It's a problem.
It's a problem, right? So that's one way DPC addresses that. We tell you how much it costs up front.
Right.
Your price per month is the price per month. It doesn't go up, it doesn't go down. Whether you go to the gym 20 times or you go to the gym not at all, the price is the same. Whether you watch movies on Netflix or you don't, the price is the same. So our concept is your price is set as a small business owner to where you know how much it costs for a member, because when you sign up, that price is locked in and that membership stays the same. So there is price transparency within healthcare, especially within DPC, not necessarily within insurance. As George just mentioned, you got a premium, you got a deductible. Well, it depends on what your deductible is and how much you've met and how much you haven't met it. And again, the part that George may not talk or speak to is the part that I know. When we are in the insurance-based industry, we have to put codes that constitutes how much service a person has. The code can be a level, and to make it simple, it could be a level 1, 2, 3, 4, or 5. If you're at a level 2, it's a lot less than if you're at a level 4. And if you're at a level 5, it's a lot more. And again, there's other codes that go along with it. Did you have a procedure? Did you have an injection? Did you have an x-ray? All these things are coded to basically give reimbursement, and that number changes. So your deductible that you're trying to get to, it could be that one visit is very inexpensive, but one visit is also very expensive, or somewhere in between. So all these numbers are basically all over the place. And for a small business person, it gets confusing. So we want to definitely clarify that DPC clears up that confusion by just making your price something simple, because at that point, you'll know exactly what the price is month to month.
Right.
Another thing that we do and that we are very happy about that we do for small businesses is that we also basically make it to where employees have satisfaction by giving them care when they need it most. So in a traditional model, when insurance is involved, a person gets sick, how quickly do you think that person is going to all of a sudden be able to be seen depending on when the sickness has started? So if it's a Monday and a person says, look, I'm sick and I'm in a traditional model, insurance being used, how quickly do you think they're often seen?
In a traditional model?
Traditional model.
Well,
Small business traditional model to be exact.
If they were being seen in a timely manner, there would be no need for urgent care.
Okay. So how much you would say?
I would say it takes at least, on average, a week or two.
Yep. So 2 to 3 weeks is standard. That's the quick visits.
That's a problem.
That's quick visits, right? So when you have a 2 to 3 week wait time for an acute problem, how satisfied are you with your potential health care at that point?
Well, you're not at all, because it just depends. It depends what happens, right? Mm-hmm. If you break a bone or if you're injured, obviously that needs care and it's just not gonna go away, right?
Right.
But if you're like feeling all crappy, have a cold, have a flu or something like that, your body can fight it off shorter than that. Mm-hmm. You're just not in a shorter time period than that. You're just having to deal with it for a longer period of time potentially, or having a worse experience with it potentially. But by the time you've actually seen the doctor, you don't need to see the doctor anymore.
Right. Correct. And at that point, you kind of segued into something that we talked about earlier. You just said the satisfaction's not there because I'm not getting the care when I need it, but my productivity potentially goes down.
Absolutely.
It's going to go down because I'm miserable, I'm sick, I got a headache, I got a cold, I feel like I got a bladder infection, and I don't want to do anything other than try to feel better. And if I don't feel better, why am I going to want to go to work and be productive? Your productivity goes down. And then another word that you'll hear us use is absenteeism. So people miss more work when they don't have good care. They are home, they're sick, they're wanting to stay home because they don't feel well and they can't be productive. And again, you can tell them to come to work, but if they are at work and they're miserable and they make everyone else around them miserable or everyone else around them sick, it kind of defeats the purpose. So again, in the small business sense, you're paying potentially for this expensive insurance. When someone goes to use it, they don't know how much it costs and they get a crazy bill on the back end and they're not happy about it. You're still somehow involved because you're still a part of the premiums and the deductibles because you're choosing what they're paying and how much you're going to contribute. Then when they do go to use it, they may not get the care when they need it most. They got a long wait or a moderate wait, depending on how you look at it. And in the interim, while they're waiting to get in, they have no productivity or very low productivity. Right. They're miserable, so their satisfaction in wanting to be at this job is going down. And it's affecting your business and your bottom line. And that's the traditional model. So in our model, we're doing pretty much the opposite. So again, you know how much it costs every month. It's not necessarily a secret or a mystery. You can pull up the bill and look at it month after month and see the price stays the same. And we do that for our employers at Byja Clinic. The other thing you also know is when someone gets sick, they need an appointment. How quickly do you think we respond when a person hits us up for an appointment or a question or a refill or something like that?
You asking me?
I'm asking you a question. How quickly, on average?
On average, I'm about to say my results are pretty good in this department because I always tell that story, man. You about to get married, my eyes swollen shut, and I got some. I had a prescription in like a half hour.
Yeah.
So.
Yeah, and our average response time is 20 to 30 minutes.
Yeah.
Right, 20 to 30 minutes. And again, that's on a busy day. Usually some people will hit us up and I usually respond literally right then. And they're like, oh, I didn't mean to bother you. And it's like, no, that's what you're supposed to do. But 20 to 30 minutes turnaround is a lot better than 2 to 3 weeks.
Right.
Especially if you're a small business owner and you're depending on your employees to be there, be healthy, be productive. So 20 minutes is a lot better than 2 to 3 weeks. So that's the first part. The second part is how quickly do you think we're getting them in? Because the first thing is getting in contact in 20 to 30 minutes. So it's not saying when they call, it takes us 20 minutes to answer the phone. It's that we're going to literally have something working in 20 to 30 minutes. If they're sending us a text message, maybe 20 to 30 minutes. If you're calling, it's usually a lot faster. But how long do you think it takes us to get them in?
Well, you can get them in typically in the day or worst case scenario, the next day.
Yeah. So same day, next day.
Yeah. Same day, next day. Worst case scenario. And also, let me add, a lot of these issues, you may not need to come in.
Yeah.
You know, it just depends on what's going on. Like the young lady we talked about a few weeks ago who needed the stitches.
Yeah.
She needs to pull up.
Yeah, absolutely.
You know, but if I'm just feeling crappy and, you know, I got a Walgreens or like another pharmacy or something across the street, I can just get a prescription. I can walk across the street and I'm good.
Yeah.
You know what I mean? Because it just depends on what's going on.
Right. Get it. And I think the other part that you're highlighting that is very, very close to what we're talking about is I have access, whether it's a text or a phone call. I can come same day or next day. I know how much it's going to cost because, again, your price is the same whether you come in or you don't. If you're coming in for something in person, we're not charging you more versus if you're texting us or calling us, we're charging you less. It doesn't work that way. That's the traditional side, right? And let's pivot right back to the traditional. Do you know why they oftentimes want you to come in so much?
So they can charge you or your insurance a copay or for a visit.
Yeah, they don't get paid if you don't come to the office. They can't oftentimes bill you for phone calls and text messaging. Now that's starting to change. They're starting to change where they can hopefully send a bill for you texting them, and people who have MyChart, which I love to hear, oh, MyChart is great for you because you think, well, I send these messages, the doctor responds, everybody's happy. They are miserable. The doctors are getting bombarded with MyChart messages to the point where they're starting to try to find a way to charge for that. Because people are asking medical questions that take long times and discussions, and they have to have a doctor sit down and write a message, and they think literally that's normal. And again, let's take it out of healthcare for a second. If you did that with your attorney and you wrote them a message and asked them to respond and give you legal advice, do you think that they're going to say this is free?
No.
Absolutely not. They're going to charge you for that actual email response.
Man.
So imagine now that the doctors are going in the same direction, and people can be upset that the doctors shouldn't do that. But doctors have to get paid for the work that they're giving, especially if they're giving medical advice. So I get the charge part. But my point is, if they're not going to want to do the messaging because they're getting slammed and they're not getting paid for it, why would they say, yeah, let's do this for free? So they're going to tell you need to come in. And now you're coming in with everybody else who's sick, having to sit in the waiting room and having to deal with all of the stuff that you're saying you absolutely hate. And on our end, on the DPC side, as a small business owner, which we try to explain, is that when your people are sick, we take care of it as soon as possible so they can, number one, feel better. Number two, know how much it costs. Number three, get back to work.
Yep.
So at this point, why would you say, hey, insurance must be great because I got great insurance, even though I don't know how much it costs. I don't know how to use it or when the use is necessary, or should I send a message or should I not? But they're not going to respond to the message because they're going to tell me to come in, because in order for them to get paid, they got to come in. So it's this dance of confusion. Whereas on our end, we just tell you, look, you don't need to come in. Your price is the same whether you do or you don't. You want to come in, come on. If you don't, do this, and hit us up and we'll let you know if we need to make some changes. And it works much better because everybody in that side, where it's transparent, it's upfront, and there isn't a price attached to every single small thing, it gets a lot better and it's a lot more streamlined. And oh, by the way, the insurance you do have as a small business, it's there if we need it for the big stuff that George mentioned. You're not using it for every little thing. So guess what happens to your premiums when you don't use them all the time?
It goes down.
It goes down compared to the other insurance industries where you tend to see premiums not going up by 7% a year. They're going up by 1 to 2 to 3%. Our premiums in healthcare are going up by 7 to 10 to 15 because we're using it all the time for every little small thing.
So, I'm glad you said that, and you brought up a question I've been burning the ass since we started this episode. I'm going to put you on the spot.
Yeah.
Are you ready?
I'm ready. I'm locked in.
So, I'm a business owner.
Okay.
All right. I got 10 employees.
Yes.
What's stopping me from sitting down with Byja Clinic and saying, hey, I need a group rate for 10 employees, and I am going to take this rate. I might pay some of it myself, but I might withdraw some of it out of their check, and I'm going to provide them with critical care insurance in case someone needs to be hospitalized. As a business owner, why should I not do that? And B, how easy are you to work with a business owner to get that done?
Yeah. So number one, great question. your journalism chops is getting better. Like, that was a very well laid out question for me to, as the interviewee, to follow. And to literally, it's like you alley-ooped it, right? Like, I got to just slam it home. So
please slam it home.
Yeah, absolutely. So, number one, kudos to you. Like, that was a very well-executed question. I was really intrigued, right? I'm like, oh, okay, George Gumble, as we talked about previously. So
Brian and Gray's little brother,
right,
that y'all didn't know about.
Right, they've been sleeping on you, right?
Yeah, they've been hibernating.
Should have never gave you a microphone. So, at this point, to answer your very well put together question, what's stopping them is them. That's the best way I could say it. It's free to talk to us. We don't charge you. I don't get paid to come and talk to you at your office. I wish I did, but I don't. I've literally been to business owner after business owner after business owner's office to tell them who we are, what we do, and offer our services. If they don't take it, no problem. At some point, that may change. But we are always willing to sit down and talk to business owners and say, this is how it works. This is how much it's going to cost you. You don't have a crazy contract where you're signing up and having to be locked in for 17 years and somehow you magically can't get out of it. We're very much a open book when it comes to employers, and we love making it work, because this is my favorite thing I tell anybody in a business owner's seat. I don't really somehow magically do well if your door is closed. I've never really figured out why I'm going to charge you some exorbitant amount, and that's going to bankrupt you, and somehow that's going to keep me in business. It doesn't help me to literally make your employees sicker and hate you as a business owner by giving subpar care and charging high prices. It's more beneficial for me to keep you in the good graces of your employees and keep them healthy, and then do it at a rate where it's affordable, so when you thrive, we thrive. Right? So to sit down with us, it's really inexpensive, easy, and it's convenient, because I will come to you and have that conversation. The other part is how much. We literally sit down and run the numbers and tell you up front. It's not, well, we're going to tell you a number, a premium. We're going to tell you another number, a copay. We're going to tell you a third number, a deductible. And then somewhere in between all these numbers is your number. That doesn't work. It's literally, for us, your membership per person per month is this. And if we multiply that times 12, this is how much it's going to be at the end of the year. That's it.
Right.
It ain't some tricky math that may or may not happen. The only time more dollars get added is if the person wants to cover more stuff for their employees. If they want to cover medications that we dispense, we can do that. If they want to cover labs that we perform, we can do that. If they don't want to and just want to do memberships so the person can walk through the door and see the doctor and not worry about how much is it going to cost to see the doctor, how long is it going to take for me to get it, if they just want the access, that is a set price per month, and it literally is the set price.
Well, and look, just in my experience with the clinic and in the model, because I've been in the model about 4 years now, something like that.
Strong 4.
And strong 4, man. 3 is the best number, but 4 is cool.
There you go.
But anyway, I digress. But look, so what I guess my point is, just the membership fee would be a big enough benefit in itself, because everything else is so affordable to where, an employee could potentially pay that on their own to take care of themselves. Yeah. Just being realistic, right? And in a traditional model with traditional insurance, you would pay the copay, you would pay this, you would pay that, you pay for your medicine, everything like that. So you're actually coming out cheaper if your employer pays the membership fee, and all you're paying is for like the labs if you need them, which is once a quarter.
Yep.
And I think that's really great that we do that here. But that's a little that's a little higher than average in my opinion. When most people get labs, and they're not expensive. Your medicine, the ones that you dispense here, are not expensive.
Yep.
So if an employer only pays the membership fee, that's a major benefit
100%
to an employee.
Yeah, and I think it's a benefit for the employer as well, because now the employer knows that I can't come to work because I'm waiting to go to the doctor and it's taking 2 weeks.
Nah, that's foolishness.
That's foolishness at this point, right? Because more than likely, they're going to come in same day or next day, or they can call us, text us, or email us to get an answer of what needs to happen for their health care. Doesn't take that long. It's less likely they're going to miss work. Now, unless you just don't want to have that conversation because you don't really want to say, I want you at your job. Look, I want you to take as much time off as you want while you're sick because I don't need you here, small business. Small business owners, hey, I don't need you here. Take all the time you need. If that's the type of business you're running, then keep it.
Then you need to tell me how to run business because I need to be doing what you're doing.
Right. That's what I'm trying to figure out because for me, all of the business owners that we take care of, they love the idea that somebody's injured or sick, we have an answer for them in the same day.
Right.
And there is a plan in place for them to return to work or not. And at that point, when they are returning to work, you know they're healthy because we've had basically time to give them a thorough examination and a treatment plan that will be very helpful. So the productivity returns, the satisfaction returns because people feel better, faster. The employer is happy because their cost is capped or managed and transparent. And more importantly, everybody is winning at this point. It's not where the employer has an unfair shake. The employee has an unfair shake. The doctor has an unfair shake. And the insurance company is sitting there twiddling their thumbs saying, I don't see what the problem is.
Right.
In this instance, the insurance is on the outside waiting if something big happens, much like car insurance. In car insurance, they're not sitting there getting your dollars when you go and pump gas, when you rotate the tires, change your oil, wash your car, and all the things in between. You as the driver and basically everybody else is operating independently. And then if something major happens, insurance comes in at that point.
Yeah. Imagine if there was something like this for car insurance. Imagine, this is the way I look at it. When we talk about the clinic, it's like I'm only paying liability.
Right.
Because I got this super high deductible because I know I'm not really using it. And I only keep it in case, I don't know, I need to go to a specialist or something happens, I need to be hospitalized, right? But outside that, I don't even use it. So it's like I'm paying for like liability when you got all these other people paying for like full coverage.
Yeah.
And it's like way more expensive. It's like an alternative to the full coverage in my mind.
Yeah.
That's the parallel I kind of look at it.
And it's a very good parallel. And like you said, it may not be for everybody. Some people may need the big insurance plan and using it all the time and all that because they have that type of need. They're that type of driver. They need that type of coverage. But a lot of us don't. And if you're someone who's getting started, you may not want to spend on the biggest, most expensive policy while you're trying to launch your business and find a way to keep people engaged, healthy, and not missing work, and definitely decreasing the idea that you're going to spend a lot out of pocket on something that you really may not see a benefit from. If you're spending $10,000 per employee per year and you don't get a return on that, you would probably say this is a waste of time. So why am I going to spend this unless somebody makes me spend it? Hence why when you hit 50 employees, you then have to give people insurance. Compared to when you're under that, your goal is to really and truthfully keep your business going and keep your costs down.
Now, question. That's another question. When you say you have to give people insurance at 50.
50 employees.
50 employees. What type of insurance do you have to give them?
Right. So
or do you have to give them health insurance or just any health insurance?
Yeah. So there are probably certain guidelines, but you more than likely have to give them some type of health insurance coverage. That may not be the most expensive plan. It could be the very, as you just said, high deductible plan or that catastrophic plan. The goal is at a certain point, you are now mandated to offer health insurance through your company if you hit that. But until then, you're skirting by and saying, I want to keep top talent. I want to keep my costs down. I want them to come to work. I don't want them to get sick. I want them, when they do get sick, to come back to work quickly. And I have no idea how to do that other than just to hope and pray that they stay healthy, stay happy, and I don't have to spend money when something happens.
I would just challenge people to crunch the numbers.
Yeah.
And understand what you're looking at. Because, from an employer or employee type of situation, I used to just pay for the most expensive health insurance. I'm almost embarrassed to say because I would just be like, well, look, I just want to make sure I'm okay if something happens, if I need to run to the doctor, blah, blah, blah. And I was like, ooh, $30 copay. Oh, yeah, this is nice. But I was spending $150 more a month.
And not using it.
Just to have a $30 copay.
And not using it.
And not really using it. But hell, even if I did use it once a month.
Yeah. Once a year, maybe, right?
Like that. But even once a month, the numbers didn't add up.
I get you. I see what
you
you're
know
saying.
What I'm saying? Or like especially once a year, it absolutely doesn't add up.
But that's some people, right? I got the most expensive plan. I'm healthy. I have no reason to go other than someone saying I should go because if I go once a year, I get a check back, right? I get an annual wellness. I get a check back. So I'm going to go because they're basically paying you to go. But they're not really giving you a check back. They're literally just cutting into their profit slightly to incentivize you to do what? Go and use your insurance. So that check that they gave you that you think you're magically getting, you're giving them a copay. Mm-hmm. And if you say, well, the copay was waived on the annual visit. Okay, but when the bill gets dropped by the doctor, the 1, 2, 3, 4, or 5, that $250 check that you got for your annual wellness is gone because guess what? You got to pay that bill on the back end because you just said, I still haven't met my deductible. And at that point, that person more than likely is still paying for that actual visit, even though they think they somehow got over. It's really a good hustle, right? And this is the part you said, let's talk and crunch numbers. So we got numbers, right? And I bring this up because I had a employer reach out. We literally have that relationship where they say, hey, man, I just want to see how our numbers are looking in terms of our cost and what we've been doing this year with our employees. This employer, we're going to go over some numbers that the employer has. This is an actual business in Baton Rouge that we work with and take care of not only their employees, but the dependents of the employees, right? So people who are not only working, but then the dependents of the workers. It's almost like we're covering everybody, right? So this business came to us and basically signed up employees. And then they said, we like this so much, we want the employees' families to get care through your clinic. So this is the question. This is the case. We already talked about how much does it cost for an individual per year for premiums only. Okay. And we also talked about a family for premiums. Let's see if you remember the numbers. What were the numbers for the family versus the individual when it comes to premiums?
The individual is about $9,000 and the family is like $24,000.
Okay. For us in this one business, we literally ran the numbers and they have 9 employees. Okay. 9 employees. The average cost for a year of care, 30 days a month, 31 days, 28, whatever month we're in, for a year of care, the cost for everything all in was $2,436 per person. Okay. For the year, $2,436 per person, not per individual, per family. Like it didn't change magically when I had more people. It's per person compared to $8,000 to $9,000 compared to $24,000 for a family. You know how much savings that is, my friend? Again, even if you don't do the math, we were about 4 times lower.
Yeah.
Right? Because 2,000 compared to 9,000, 2,468, right? Like it's not hard. You're literally about 3 to 4 times lower than just the insurance premiums alone. Again, we're not talking about the deductible that they also possibly have to pay. We're not talking about the co-pays and everything else. We're just talking about premium to membership.
No surprise urgent care bills.
No,
I'm still mad about that.
So no urgent care, which I didn't even think about. So we're saving them exorbitant amount just for them to have access for a whole year.
Shameless plug.
Yes.
Sign up now because the price has changed.
Yesterday's price.
Yesterday's price is not today's price.
So,
but once you sign up, today's price will be your price going forward.
Yeah, and I remember that we had a meeting and you came to the meeting and I showed the prices to the people and you were like, I ain't paying that. And I started laughing because I was like, maybe I shouldn't tell people that other people were grandfathered in, and we do that honestly.
That's real.
When you sign up and you give us the opportunity to take care of you early, we lock you into that price because we feel like you earned it.
I kind of look like, it kind of reminds me of buying a house.
Yes,
because when you buy a house, your mortgage, you might have a little insurance, some escrow things like that. The price might fluctuate a little bit, but man, look, that mortgage is gonna stay almost the same compared to renting a place
where the rent continues
and that rent continues to climb,
just like the premium.
Because you talk about $2,400 a month. I'm like,
no, a year.
Excuse me, $2,400 a year.
Yes.
Patient zero don't pay $2,400 a year.
Correct. Right.
And I'm just saying.
Right. And that's what I said.
Patient zero paid the average price.
Correct.
4 years ago.
Correct. That's right. And that's why it's funny because the employees in this group have been added throughout time.
Right.
So some of them have a very low rate and some of them have a high rate, but it averages out to about $2,400 per person per month. I'm saying per year, per person per year.
So sign up now.
And on top of that, this is my favorite part. We just talked about their prices are staying the same.
Yeah.
The premiums on the insurance will not.
At all.
At all. So you're saying, well, look, that's still a lot. Okay, right now, it's seemingly a lot, which I know it's not. But as you go on, that 8,000, 9,000 for the individual will be 10 to 11 or 11 to 12. And then that 24 for family may be 30. And all of a sudden you're sitting here scratching your head. So that's one example that we are sitting and knowing that we're saving this one company. And again, we have multiple employers. This is just one. The lab test part that we've talked about, we didn't go into a ton of detail about it, but we have the ability to do something where in our clinic, and other traditional clinics cannot do this, or they choose not to, those clinics will offer you to do labs where you use your insurance every single time. When you go to do your lab and your blood work and your urine testing, they ask you, do you have insurance? And if you do, they run it through your insurance. Whatever the insurance has a deal with from the lab company, they pay X amount, whatever that number is, and then what's left over may come to you. Sometimes it's nothing, sometimes it's a lot. Why am I bringing it up? We do labs through our clinic where the patient pays us and we pay the bill for the patient. Why do we do that? Because the lab companies give us a discount. The lab company says, if Dr. Jasper pays the bill, I know I don't have to chase him down to get my money. He's going to pay his bill religiously. So when he pays his bill, for him coming and paying every time like clockwork, we will give him a discount.
You know what?
And I take that discount and turn around and do what?
Give it to
our patients and our employers.
I've always wondered why my labs was cheaper than if I actually used my insurance.
Because I'm a good guy.
Because there's been times where you be like, hey man, you want me to do these labs or you want me to run it through insurance? So naturally, you say, hey man, I want to run it through the insurance because you think it's gonna be cheaper, and it doesn't. It's not cheaper.
It's not cheaper because no one knows how much the insurance has contracted with the lab company to charge for that lab.
And I'm like, it's the same lab.
It's the same exact.
And I don't understand. And I'm glad you said that because I've always wondered, like, I'm gonna just go through the clinic. It's cheaper, but I don't understand why it's cheaper.
Yeah. It's a magic genie that we have a contract with, but no, it really is.
Is it the genie from Aladdin?
It must be. It must be. Is it Will Smith Aladdin or Robin Williams Aladdin?
Robin Williams Aladdin, because it's a whole new world.
I wasn't the genie, but I see what you did there. I see what you did there. But let's get back to the labs, because as you just mentioned, the labs are a part of this. It's not the only part, but it's a part of it. So when we take that discount and give it to the patients potentially will say, well, Dr. Jasper, we're going to just do our labs through you. This employer gets it. They sat down and said, well, how much is it to run labs and how much is it to run labs through your clinic? And I say, well, look, we can give you some random numbers, but at some point it's going to be cheaper because we are running labs at a much lower cost than your insurance will ever give you, because there is no reason for us to mark it up like they do. So in this case, we did 118 labs in 2024 thus far. This is from January to November. 118 labs across all their patients all their dependents and their employees. Mm-hmm. And how much do you think we saved ballpark based on numbers that we were able to run compared to their insurance stuff, compared to where we are with the 118 labs, using the concept that we get a discount and we give the discount to them. They pay us and we basically pay their bill and we pass the discount on to them. If they use their insurance compared to us with those 118 labs, how much do you think we saved them? Because we already know we saved them money.
But
how much do you think?
I'm reading my notes, and I think this is a typo. It says on my notes, $51,000.
$51,000. We saved them $51,000 on labs because, again,
bro, that's like maybe 2 to 3 fleet vehicles.
$51,000.
$51,000
on labs.
So like you could go get like 2 or 3 work trucks for your business with that savings.
Correct. And they literally are smiling when we give them these numbers, because they're like, we save $51,000 on labs, not on healthcare, just on the blood work, not to be interpreted, not to be actually treated, just to order the test, somebody run it and give you a piece of paper with numbers or positive, negative on it. 118 labs, from the beginning of January 2024 up until roughly late October, mid-November, they have saved $51,000 on labs only.
That's
Last
insane.
thing, and then we'll, again, slowly close out. We are doing prescriptions through our clinic. So as you know, and some people may know, but to the small business owners, if you're listening, in the state of Louisiana and other states around the country, certain doctors have the ability to get a dispensing license. And what a dispensing license is, you as a physician have the ability to not only write the prescription, but also to count the pills and then dispense it. When you do that, you're dispensing more than likely generic medications. You're not dispensing the most expensive brand name stuff. And again, that's okay. But in those dispenses of generic meds, the price tends to go down because you don't have as many people in the equation. You don't have as many pharmacies and administrators and pharmacy benefits managers and all these people in the equation. So as an employer, when you go to pick an insurance and you're picking drug coverage, you're paying a part of those prescriptions when they go to fill them. So if your insurance has a deal with CVS to mark up the cost of the medication, then CVS is going to literally get a cut. Your insurance is going to take a cut, and everything left over goes to you and your employee.
Yep.
So at that point, there's a price.
So can we even talk about the convenience of that?
Well, I think we can. We can segue to that.
I'm sorry, I didn't mean to cut you off.
No, I'll leave it on. I'll leave it on to you.
Because you struck a nerve just now, and you know I'm gonna call him out. Like I don't normally call out people, but I'm gonna call him.
Go ahead. Go ahead.
You know, I was
Is his name Tyrone? Because I heard you need to call him.
Yeah, man. We need to call Tyrone. We need to call everybody on this.
Call everybody.
Because look, man, I was living in New Orleans.
Yeah.
And you know, I'm not really a big. I'm a loyal guy because I like to put my phone number in places and get coupons and stuff like that. That's what I like to do. So if I'm gonna go to one place, I'm gonna keep going. So I was going to Walgreens, and you know, not because Walgreens is amazing. It was just close to me. I put my phone number in, and I always get a coupon.
Yeah.
So that's my type of jam.
Yeah.
Right. So I had this medicine that I was prescribed. I think that was before I joined the clinic.
Yeah.
And they said, well, it was a high risk medicine. I don't know what a high risk medicine is, and if it is, and if there is a high risk medicine, I'm not sure what I'm doing with it. But
did it have a skull and crossbones on the bottom?
right? What the hell? Like, but I digress.
Yeah.
But anyway, so apparently they were not comfortable, or they did not feel safe. My prescription insurance with Walgreens handled it. Well, my prescription my prescription insurance was CVS Caremark.
Oh, yeah. I already remember it now.
So
I remember the story now.
So I either had to get the prescription in the mail, which I don't know how, you know, safe a prescription is being left on the porch in New Orleans if it's high risk.
If it's high risk.
You know, my bicycle didn't do well. But, you know, I digress. Or I had to go to CVS where, I don't know, excuse my ignorance, but CVS looks exactly like Walgreens on the inside. It's just with different signs. So I didn't understand that. But long story short, the business aspect of it, because I had one insurance, it forced me to change my routine and change what I was comfortable and normal doing.
Yep.
Because of there was an insurance involved, and they were in business with one pharmacy versus the other one.
Correct.
Where long story short, now I just go through the clinic.
Yeah.
And I could just get my meds before I leave.
There you go.
And just go by my merry way.
Yeah, and you don't have to figure out what insurance will pay for what med, at what time, at what pharmacy, at what rate.
Right.
Right? And again, you're an employer. How much time do you have to figure all that out?
None.
Exactly. So as an employer, the employees in this business, the employer said, we're going to not only cover their labs,
Right.
because we want them to not have the undue burden of having to pay for their labs and get these bills on the back end. We are also going to pay for their generic medications coming through the clinic. So if a person comes in and has high blood pressure or diabetes or cholesterol or a strep throat or a bladder infection, we have medicines in stock to treat those things.
Right.
And we keep them at the ready. If a person has knee pain or has a muscle pull and they need a muscle relaxer and they have a sinus infection and need steroids. We have all of those things because they're generic and they're pretty inexpensive to get, especially if you're buying it directly. Right? I don't have to go through 14 people to order it. I can order it myself and stock it myself, so the price goes down when you have less people in the equation. So with those meds, we did, again, analysis of how much can it cost on insurance for a prescription, per prescription on average, right? On insurance, the cost for these same meds was about $15 per prescription. Per prescription, okay? Do you know how much it costs these people on this plan for their medications coming through the clinic when we started to do the math and running their numbers for 2024? Now, it's not in your notes. I'm going to just see if you can kind of come up with it.
I'm going to say, let's see, saving $10 a prescription.
Okay. So the cost average per prescription was $3.
Yeah.
Per prescription. Per month, per person, we did the average. Per month per person was $11 for a whole month. That's how much medicine per prescription, $15 per prescription. So if you had 5 prescriptions, right, you're spending $60 to $75, right? Compared to for a whole month, you're spending $11. So they literally, over 78 prescriptions for the year, have saved about $1,000 to $2,000 just on meds.
That's crazy.
Just on meds. And again, this is just us doing round numbers and math where we're pulling data and looking at it. So we're saving them $51,000 on on labs. We're saving them about $2,000 on meds, and then we're saving them
$6,500 a year on the premium.
On the premium side, right? And their employees are at work, and their employees are more engaged because they're not sick. They're also happier because they keep money in their pocket when they get their medications. They don't say, hey, I want the most expensive medication that you have on the shelf. You know what they say? I want a medicine that's going to make me feel better, and my employers are paying for it. I'm happy. I'm not going to try to basically do that. And more importantly, they got me sitting in between to say, hey, I'm not going to give you the most expensive medicine because you don't really need it. You need a medicine that's going to get the job done, and this works just as well as this, and we're going to basically do right by the employer. We're going to do right by you, and we keep everybody happy because if your numbers are good and the employer is still in business, and I'm able to do what I really went to med school to do is care for people, why are we going to have any problems? We won't. So we're not running up a bill over here. We're saving people money. We're saving people time. We're saving people energy. We're keeping patients, aka employees, engaged. And then on top of that, this is also extended to family. So wouldn't the employee and the employer be happy that if a person says, I can't come in
because I need to care for the kid
or the wife or the husband to the doctor, and the doctor is going to take a long time for me to get my kid in. What if the same doctor is seeing you and your kid and you know it's going to be quick? Literally happens all the time.
And look, I think there's two things that you're not really stating on these prescriptions.
Yes.
It's because because you're a doctor, you don't see the patient side of this. So a couple of things. Number one, I've had to make some decisions, some business decisions inside these pharmacies, right? like that happens. Like you feeling terrible, you go and they say, okay, well, this medicine is going to run you $7, and then this medicine is going to run you $92. And I'm like, so what is this medicine that's $92? I'm getting the $7. Don't worry about it. You keep the $7. But you
can put that in the bag.
You can bag up the $7 one. Now the $92 one.
We gotta have a talk.
What does this do? Well, is it?
You're not making a good argument in this.
We might go ahead and put that $92 medicine back.
But this is my favorite part. I'm gonna help you out because I've had patients say, "Well, how much is it for about 5 of them?"
Right. I've done all of that. Matter of fact, I had some food poisoning recently. I said, the lady said, "Yeah, this medicine is like $150." I said, "For what?" I was like, man, like, I only need 5 of these. Like,
Right, exactly.
I'm gonna be straight.
I'll be fine.
But
And the funny thing, and I remember the medicine. This was medicine for nausea.
right. Like, why do I need 90 pills for nausea?
So for me, and we can have this honest discussion. This is why I love the actual radio show. I wrote 90 because I was like, look, I'm going to give you the standard amount, which is you can take these 3 times a day, and I'm going to give you 30 days worth. So 30 times 3 is 90.
Right.
That's how we tend to write most prescriptions.
Well,
right?
I'm cool with that.
But this is my favorite
for
part.
the right price.
Well, that's my favorite part. In my clinic, that 90, you said how much was it?
That was like $150.
Okay, that 90, because I just wrote it literally today, that 90 was $8. I just gave it to somebody earlier today. A lady came in and said she wasn't feeling well, so I said, well, I give you 90 pills. It's like $8. So when I'm writing it to the pharmacy, I'm thinking, well, it's going to be about $8, right? It ain't no big deal, and these are going to have more for the future. So
backstory. I feel like we need to tell a backstory.
Yeah.
Because, so in all fairness, I had food poisoning, and I had the trash can by the sofa.
Yes.
Vomiting.
Yes.
Profusely.
Mm-hmm.
And I got a Walgreens across the street from my house.
Oh, yeah.
The clinic is 20 minutes from my house.
Correct.
So I said, well, just call it in, which was the biggest mistake I ever made in my life. Because common sense, you like, well, it's right there versus coming way to the clinic.
Right.
Should have came to the clinic.
You should have.
because the thing about it, the convenience of the clinic, you get your medicine,
Correct.
and then you go in your merry way.
Yeah.
So let me tell you what happened to me that day.
Oh,
So
I can only imagine.
So I go there, and think about it, this is real life stuff, like stuff you don't see.
Yeah.
So I go there. You tell me you call the medicine in. So I wait a little while. I walk across the street because I don't feel like driving.
Mm-hmm.
But I walk across the street to the drugstore.
Yep.
I'm feeling terrible.
Yep.
The medicine's not ready.
Oh.
It's gonna be ready in about an hour.
Oh.
So I go back and I lay back on the sofa.
Yeah.
So of course they text me in 20 minutes saying the medicine was ready. But I'm back on the sofa now.
Right.
I'm feeling terrible.
Right.
So you think I just immediately just got up
And we go get it again? No.
and we
Of course
got
not.
because I waited.
Mm-hmm.
So I waited. A couple hours go by. Throw up again.
Mm-hmm.
I'm like, all right. Well, I guess I really need to go get this.
Right.
So I go get this. There's a line in there. It's like a lot, like a food line.
Right. Like
I'm like, why are these people in line back here?
Correct.
So it takes forever for me to get the medicine.
And then
I get up there and she's like, that's $150. I'm like, for what?
Right. A generic med.
I'm like, look, let me get about 5 of these, bro.
Easily.
Easily. And just go about my business.
And the beautiful part. Go ahead.
But I'm gonna finish. So I like let me get about 5. Well, it's filled already. So we need another like 30 minutes
To separate.
to separate to change the prescription. And I'm just sitting there like, bro, I'm not going back home. So I go lay over, I go sit down, I go mess with the blood pressure machine for a little while, because I'm bored. You know what I'm saying? I'm not feeling terrible.
Start doing laps.
And I'm like, man, I pick up like some snacks, some Pedialyte because I'm dehydrated. I've been throwing up. I pick up some beef jerky just because. Mm-hmm. But it's like,
it's miserable.
It's awful.
It's miserable.
But think about it. Think about how much time I wasted in that process.
Correct.
Whereas if I would have came into the clinic, got diagnosed and got a prescription, and then just got my prescription and went on my merry way, I probably would have been feeling better hours before I was feeling better.
Yes.
And then my crazy self, I just want to walk across the street because that's quote unquote convenient. Mm-hmm. And it was terrible.
Yeah. And that's the unfortunate part that a lot of people don't think about, because to them, they thinking about it like, well, I don't really know if I want to do X, Y, and Z. And it's not until you have that bad experience that you're like, I should have done this. And I've had plenty of patients where I say, look, we can fill it and it's probably going to be free at the pharmacy. Or you can pay us $3 and you can get it right now.
Man, I pay that $3 every time.
And I was going to say, most people say,
Every
I will
time.
pay you $3 because I now have to go to the pharmacy. Oh. I got to argue or sit in line. On top of that, it may be covered, or if it is free, it may not be in stock. And we can tell you we got it right now. Or look, we don't have it. We got to order it. This is when it'll come in. And then on the flip side, what do you think these employers are hearing whenever they get their meds filled through us? We tell them it's ready. You can come pick it up. You may say, well, the pharmacy does that too. The difference is when you come pick it up from us, there is no line.
It's ready.
It's like you come to the door. Either we're gonna hand it to you at the door,
and I don't have to swipe a card.
You don't have to swipe anything
because it charge the card on my account. We
already tell you the price before you get it. You can pay that or not. And then if you have a problem, we have no problem fixing it right at that moment because it doesn't take that long. So that beautiful part is, again, we're not only saving money, we're saving time. And as you heard, look, that country came out for a second. As you heard from patient zero, you're also saving people headaches, stressing, and everything that comes with all of the ups and downs of having to go into some of the pharmacies that are out there, and you just are dealing with misery after misery after misery, because not only are you dealing with sick people who are trying to get meds, some of the pharmacists don't want to be there either.
No, they don't. They're miserable. And I got a question.
What's the question?
Not to keep going in on the pharmacy,
yeah,
but just something I really don't understand, and maybe I need to ask the pharmacist. But why do they close for lunch? Like everybody go to lunch at the same time? Like seriously? Like you ever been in the pharmacy? And it's like you just happen to be out and about because you're running your errands.
Yes.
Because my insurance. So most people, you have a Walgreens and a CVS right across the street from each other.
Right.
But not by my house.
Right.
I have a Walgreens. There's a pharmacy in the Walmart.
Yeah.
But there's a Walmart pharmacy and a Walgreens pharmacy in the Albertson pharmacy. But there's no CVS.
I get you.
So
you gotta go look.
Sometimes. If my insurance tells me I gotta go to CVS, I gotta find a CVS. It's not close to the house.
Right.
So if I'm out and about running my errands, that's when I'm gonna do it.
Yeah, you go ahead.
And then I pull up. Everybody in the pharmacy department went to lunch. Like they go to lunch together.
They don't stagger.
They don't stagger. There's only one pharmacist and one tech. Like I don't, or like why couldn't they just have the person there who could just hand you the medicine if you just showed up? I don't understand it. Like, why are they all going to lunch at the same time?
It's big business, and I think the best way to explain it is you got a lot of big businesses that don't really care about you like they would care about you if you were in a smaller business, right?
Yeah, but
when you're in a smaller, more intimate setting, whether it's a restaurant, a concert, or anything like that, you have a different experience than if it's one of 5,000. Because again, pharmacists are getting burned out as well because they oftentimes are in these big retail settings and the volume is insane. They're getting basically treated horribly because people are sick and they want their medicine, and they take it out on the pharmacist because their insurance doesn't pay. I told you, insurance is genius that they literally are in between every transaction. They mess all of them up. And then when they mess them up, you don't get mad at the insurance company and do anything. You take it out on the doctor and the pharmacist and everybody who's on the healthcare side, because we're the people right in front of you, even though we're not the ones making the rules.
So serious question.
Yes.
Think about it. And I'm thinking about this. You've talked to people who work for the insurance company all the time.
Yes.
Because you're a doctor.
Yes.
I'm a patient.
Yes.
I don't know when the last time I talked to anybody with the insurance. They're like the invisible man.
Yeah.
Because I'm going to talk to you.
Yes.
I'm going to talk to the pharmacist. Well, I don't really talk to the pharmacist no more because
ever since the 150.
I'm tired. Not even the 150, bro. Just the fact that it wasn't ready. And then they told me it was going to be an hour, so I went home to lay down, but it's ready in 20 minutes. I could have just stayed there.
Yes.
But whatever. But anyway, I don't go to the pharmacy.
Right.
If I can't get it from you, I don't know what I'm gonna do. but I try. I talk. People talk to the pharmacist. People talk to all these other doctors, but the average person never talks to the insurance.
Never.
And especially when you're doing open enrollment through your job, you click a button. That's your insurance.
Yep.
And that's it. There's no communication with them. You don't know what they cover. You go to the eye doctor, they tell you what your benefits are. You go to the dentist, they tell you what your benefits are.
Correct.
But you never talk to the insurance people. And
who making the most money and making the most decisions and have the most authority? The people who don't have to talk at all. It makes absolutely no sense. And that's why in this episode, as you can hear how animated Patient Zero is about this is something that's very serious. And it's not because he has the best skin in the game in terms of, look, if I shut the insurance company down, I somehow win an award. Like, it really is just frustration that everybody knows.
It's irritating.
And everybody knows this feeling. But then when we come and say this is a solution, people get nervous, right?
Right.
I've literally talked to business owners and they feel like, look, well, I got to think about it because they didn't had their insurance plan and their broker for so many years that now they're going to somehow alienate the broker by saying, well, I want to bring someone in who may actually help us have more employee satisfaction, more productivity, keep people from missing work. I'm going to know my cost up front. I'm going to also be able to use insurance for big stuff when I need it. And I'm going to help my bottom line and pay employees, and my dependents are going to be much happier. They literally get nervous because the brokers oftentimes will tell them, well, I don't know if you need to do that because this is what DPC doesn't do, and DPC doesn't do this and doesn't do that. And a lot of stuff they're saying, it's not intended to do all that.
Correct.
That's what insurance is supposed to do. Well, DPC doesn't cover if you go to the hospital. We never said we were. We never said we're going to stop you from going to the hospital to where you never ever going to need insurance. And you should know, you should still have insurance coverage, just like when you're driving. Just like when you're operating certain things, you have insurance to cover you in case something happens.
Thanks.
So the DPC part is the primary part. We're keeping you in the primary sense so you don't have to turn the ER into your primary care place. You don't have to turn the urgent care into your primary care place. We are putting the primary back in primary care.
I'm still mad I got that bill.
I'm sure. I could see it in your demeanor, my friend. So this is the part that I'm trying to get through to everyone who's listening, especially if you're a business owner, especially if you're a small business owner and you're trying to figure out this healthcare stuff. The direct primary care team of people across the country, and we're a small part of that, we are sitting here telling you it is doable. We will save money. We'll save time. Your employees will be happy. We will literally have them with prescriptions in hand if they need it when they walk out the door so they can get back to work and also have the best health. And it's all upfront and transparent. So what is the problem other than you're nervous and you don't know what to start and say and do? We're here. We're literally willing to come to you. We can do a virtual visit, meeting, whatever you want to call it. You can come to us. We have an amazing conference room. How do we know? We record in it.
Right.
We record in it regularly. This episode you're listening to is being recorded in our amazing conference room because it is that type of place where we want you to walk in and feel good and actually love coming to the doctor. So we're doing all that to say you can do this if you want to. If you don't, no problem. But there is no reason for you not to have enough information. If you're listening to this episode, we wrote a book that talks about this from an employee standpoint where there's a whole chapter on it. And then you have us willing to sit with you, talk with you, and walk you through when it comes to your team, your company, your organization, your numbers. So I don't know what else they need, George. I mean, is there anything else you're thinking like, man, this is one thing that might help people get off the sideline that we should possibly also add in? Because I'm running out of stuff.
I help.
Okay.
Just come sit down, do a consultation. Byron will do it free with you.
It's free.
You know, all you have to do is tell them patient zero sent you, and it's free. Like just come in there.
Just name drop patient
Just
zero.
name drop patient zero.
His name holds
And look, you have a conversation with Dr. Jasper for free.
for free.
You know, he'll sit down with you. You bring your insurance, bring what you're paying. He'll help you crunch some numbers because believe it or not, I don't know many doctors that's good in math, but Dr. Jasper is.
Hey, if you like money, you need to like math. I learned that.
Facts.
I need to learn that a hard way.
Facts. That is a quote of the year.
Yeah. Well, hey.
Man, look, we need to print that on a t-shirt.
There we go. Right after the first set of t-shirts that you have.
It ain't tricking if you ain't got it.
We're bringing it back.
Yeah. That's a classic.
There you go.
But anyway, so I'm just saying, just come see Dr. Jasper.
Yep.
You know, it doesn't cost anything to have the conversation. Bring your insurance, bring your plan, and have an open mind because sometimes it works within your plan, or sometimes you probably need to lower your plan, and then you could take the savings and apply that toward the membership fees. At least that's what I did.
Yeah, and there are plenty of ways to get to what solution works best.
Right.
So that meeting is going to be helpful, especially for small business owners. If you are a small business owner, you need to sit down with us. If you work at a small business and you are confused about healthcare and you want something better, tell the small business owners or the decision makers to sit down with us. We are here trying to make healthcare better for plenty of people, not just the people who make the decisions, but you as a person who is going to use the actual clinic and the services and the medications and the labs.
Yep.
We just want to get in and have the conversation and see if it's a good fit. If it's not a good fit, no harm, no foul, nobody's paying anything. We'll go on our merry ways. But if it's a great fit and you're saving $51,000 here and $10,000 here and $7,000 here, what is the problem? There isn't, other than people just don't want to get off the sideline. So we'll leave it at that. We're going to close out, but I'm going to issue a challenge to all of the listeners. If you have questions that you would like us to tackle, whether it's about the business side of things, whether it's about healthcare, we'll do our best to do that. So I'm going to give our email out, and I want you to send us an email if you're listening and send us a question. Again, if it's a question that's reasonable, we're going to answer it. If it's foolishness, we're going to just go ahead and ignore that.
And we're going to talk about you on the next episode.
We definitely will talk about you as a person posing the question, but we're going to ignore the question. With that being said, our email is byjainfo@byja.org. So BYJAINFO, like information, byjainfo, all one word, at byja.org. So that's our email. Send us a question or questions. We'll try to get it in and try to make sure we are answering 1 or 2 questions an episode if we can. And if it's a really good question, we're definitely going to pose that question as the beginning of the full episode if it's something that we can really spend time and dive deep into. But outside of that, let's close out with a few quick things. So George, anything from this episode that you want to give people a closing thought? And then I'll do a closing thought, and then we'll say where people can find us. So, George, what you got?
Just crunch the numbers, and even if your solution is working for you or if it's not working for you, just crunch the numbers. Everything deserves an audit. So at least once a year, twice a year, see what you're paying, see if it makes sense for you. Sometimes it could be a confirmation that you are doing the right thing. Sometimes you need to make adjustments, but crunch the numbers and don't always assume what you've been doing is the best thing for you going forward.
I agree. And I will say my closing thought, and this is relevant to the small business, but also relevant to people who can really start to wrap their mind around how this movement can be helpful. There are people across the country that have done this same thing, not only within small business, but within big business and also within government municipalities. So if you are a worker potentially at a city or a state level, and you're trying to figure out how we can get better health care where we just don't have really expensive insurance with crazy premiums and deductibles, but we still have really bad health care and really bad access and really bad outcomes, give us a call, shoot us a message. We would love to sit down with those rule and decision makers within those bigger industries to start to give them a sense of how this can be done, not only from just a DPC way, but we also have our nonprofit where we're doing some creative stuff that allows people to get care at a yearly rate of around $2,000. And if you are saying as a city or government or a state municipality that you can't say, if we spend only $2,000 on primary care for a year and keep people out the ER and keep people from having to go to urgent care, we won't save money in our budget and bottom line, that all of a sudden we can put money towards other stuff like infrastructure or education or wherever else we need it. I just don't get it.
Bro, $51,000 a year savings, that's vehicles. That's fleet.
You went to fleet like 3 times.
Bro, like I'm just saying, bro, like you buy a whole work truck.
Yeah.
$51,000.
You can buy a lot of stuff with that type of savings. And that's the thing. It's either you want to make the savings and make things better or you don't because, hey, look, maybe you want to keep things exactly where they are because it doesn't benefit you to take money and save and put it towards stuff that people really need. It just helps you keep it in your pocket. Maybe that's what the thing is. But
correct.
If you are in those industries and you're wanting to learn how this can work for you, look, we actually got a mayoral race going on right now. So, hey, look, we're available.
Yeah,
Patient Zero and Dr. Jasper are available if anybody is interested in how we can help increase your budget on the healthcare side.
Yeah, absolutely.
I mean, hey, we can do that too, right?
And look, I'm glad to sit down and chat too because sometimes you may need some questions answered from someone who's made the move.
Correct.
You know what I mean? Like in terms of, my experience with it or what I did financially to make it work for me to where I'm actually saving money, even though I'm paying a membership fee.
Yeah.
We can have those conversations.
Yeah. So you got Patient Zero sitting here, and believe it or not, some of the employers that work with us are willing to have the conversation with you. If you're an employer and you're just not sure, they are willing to talk to you as well and say, this is how we make it work. Yes, we have insurance, but we still use Dr. Jasper in the clinic, and it works for everybody. It can work for you. Just go ahead and hit us up. That's all we need to do. And once the conversation starts, it may not get done in one conversation. It may take a couple. It may take a couple months, but we can get it done. And I guarantee most businesses, when they come in, they're going to literally see an immediate change in how things work on the healthcare side, and their bottom line will grow. And if your bottom line grows and you are in business and growing and thriving, what do you have to lose?
Correct.
Nothing at all. So with that, Dr. Jasper will finish by saying you can find us in a few quick places. You can catch us on Byja Clinic website, www.byja.org. The Byja Clinic website also goes along with our Facebook or Instagram. That's at Byja Clinic. We're also on LinkedIn. And then you can also find out about our nonprofit organization at Byja Charitable Alliance. That's www.byjaca.org. And lastly, if you haven't, cop the Byja Blueprint book. It is available in ebook format and also in paper book format on many platforms. If you want to Google it, you can do that. And then, of course, if you'd like to hit us up and get a copy, we have those in stock as well. But we are definitely available and wanting to get the word out more widely. And then, of course, we definitely want to just get people into care and make sure that they're good and they're thriving. And Patient Zero, where can the people find you?
You can find me on X at George.Becnel, and on Instagram at Becnel Media.
All right. So we got everything in a really good long episode, which I think that's amazing. But we will close out and we will see you all in the near future. Thank y'all for listening, and we'll catch you later.